Good afternoon, everybody. Just let you know that we will be starting in approximately 8 minutes. And good afternoon, everybody. Mark Snyder again from St. Alphonsus. We'll be starting shortly. A reminder, if you are not presenting, would you please turn your camera off and mute your microphone? And if our presenters would keep their microphones muted until we are set to go, that will reduce any potential background noise. Appreciate your help. I see Dr. Peterman has joined us. Thank you, Dr. Peterman. I see Dr. Miller is with us. We're still waiting for Dr. Shaligan, Dr. King, and Dr. Bramwell. So once they join on, we will begin at approximately 1:30. Thank you again for your attendance and your interest, and we'll start shortly.
Hi, Dr. Bramwell.
Hello.
It's Jen King. I'm the Peds hospitalist over at Al's.
Yeah, how are you doing, Jen?
Good. How are you? How are you guys doing over there?
To say today.
Well, thank God for everybody, right? So hopefully we can just push everybody, keep pushing everybody forward to get vaccinated here.
You know, just when you think you've heard the most incredible story, then you hear another one.
Yep. Yep.
So it doesn't stop.
Well, good afternoon, everybody. This is Mark Snyder. Turn my camera on here from St. Alphonsus. We will get started shortly. Unfortunately, it does not look as though Dr. Nick Shaligan has been able to join us. He is working today, so perhaps he has been called to care for somebody. So if we will probably get started without him, and hopefully he'll be able to join us. Welcome to our media briefing this afternoon on COVID and the current state of pediatric cases. You saw yesterday the Idaho Department of Health and Welfare briefing touched on the situation with pediatric cases in the state, and we heard from the superintendent of the Nampa schools. We wanted to give these providers an opportunity to amplify today on the situation that we are seeing.
This meeting is being recorded.
There's Dr. Shaligan. Thank you. He has joined us. We are recording. I will remind the reporters on the line to please mute your line and keep your camera off to minimize background noise. We will give the providers an opportunity to make a few brief comments, and then we will take questions from the press. We will start today. I will also tell you that this presentation is being recorded and will be posted on our YouTube page and made available to anybody who wishes it later. Just send us a note and we'll send you the link. We will start today with Dr. David Peterman, a pediatrician and the CEO of Primary Health Medical Group. He'll sort of put everything in context. And then we will hear from Dr. Nick Shaligan from St. Alphonsus, a neonatologist, Dr. Jennifer King, whom you may have heard from briefly a moment ago, who's our pediatric hospitalist director, Dr. Kenny Bramwell from St. Luke's Children's, and I saw Dr. Miller somewhere, but she has disappeared from my screen, so I'm sure she is here. We will start by introducing Dr. Peterman. Good afternoon, Dr. Peterman.
Good afternoon. So thank you for having me. Let me begin by a couple of comments. Many in the news media have seen me. I do wear two hats. I am the CEO of Primary Health Medical Group, and I am a pediatrician. But I can tell you today I'm the most comfortable because we're talking about children, and most importantly, I'm on this call with pediatricians. And this is a group that, of course, I have great empathy for. And I would just say that for those of us that spend our day in the outpatient primary care, we are incredibly grateful to all the doctors that are on this call, because on a daily basis, we send patients to the hospital, and now some with COVID, and these doctors are there and they take care of them. So we owe them a great deal of gratitude. Sometimes we take them for granted, but we appreciate what they're doing. I'm going to be very quick. I'm going to show some national statistics and then some unique data that we have at Primary Health that really I don't think anyone has quite in the format that we have it. So this will hopefully set the stage for the other pediatricians to give you a sense of what's going on in their various areas. Okay. So these are recent statistics from the CDC, and the CDC is always about 3 or 4 weeks behind. So these statistics represent, I believe, the last week of August. So first of all, in the last week of August, more than 200,000 children were diagnosed with COVID in the US. In terms of, there was a 5 times increase in the number of children and adolescents hospitalized during the last week of August when you compare it with the beginning weeks rates in June in the US. That's a huge increase. The next one's even bigger. There was a 10-fold increase in the number of children 0 to 4 hospitalized during the last week of August compared to June. And again, some of those of the pediatricians on this call, I'm sure can tell you in more detail about that group. But that's a scary figure, 0 to 4, 10-time increase in admissions to the hospital. Unvaccinated teens, their hospitalization rate is 10 times more than the vaccinated. If there's nothing else that is taken from this talk, and it's that statistic, which is to get the 12 and older vaccinated, I would hope that would come out of it. And then in terms of pediatric COVID cases, we all understand what's going on with various masking rules and the lack of masking rules. And again, the CDC just came out with a study in which they looked at 520 counties across the US. And clearly those counties where the school districts had universal masking mandates, the cases were significantly lower or significantly higher in those without the mask mandates in the schools. So we can go to the next slide. This slide is a little bit complicated, and actually I'm having a little trouble seeing the numbers. Let me just see if I can get closer to it. I don't know if those watching can see it, Mark. There we go, better. Okay, so And then if we could see the rest of the slide. I'm very happy, Mark, you're doing this and not me. That's fine. So what you see across the front is across the top represents Boise School District. I think the second one is Caldwell, then Kuna, Nampa, and then finally West Ada. And let's zero in on the positivity numbers. So at Primary Health, we do testing in the thousands and have throughout this pandemic. And we've tested over 150,000. And we track children in terms of their residence, in terms of their zip code. And so we match them to school districts. And historically, we've been quite predictive in terms of what we're seeing. So in most cases, I feel this is very accurate information. I share it with the state. Kathryn Turner, Dr. Turner was on the call yesterday. Again, it is rare that her data and our data doesn't match up. The slide now looking way to the left, again, I'm having a little difficulty seeing it, but maybe you can see it. What it shows is the positivity rate in the Boise School District, and it starts in July and then it goes down. What you're seeing in most cases, the positivity rate of the kids at Boise School District are lower. Now it bounces around a little bit, 14%, 17%, but there is a constancy even as you get into September when the kids are back in school. And obviously this is a school district that started with mask mandates right from the beginning. Caldwell District and this data includes Valley View. Valley View does not have a mask mandate, and Caldwell did implement one. What you see here, and this is also consistent with the positivity rate of Canyon County, it's very high. And in some instances, it goes as high as 30%. That's a scary, scary statistic. It's what you begin to see when children are in school and they don't wear masks. CUNA has not had a mask mandate throughout, and there's no other way to put it. You look at those numbers, they're very high, they're consistently high. There's nothing about it that peaks out. Nampa School District, again, no clear mandate. And again, very high percentage rate and no sense of going down or leveling off. And then finally, West Ada, again, we see their rate in a sense getting higher in the 20% range. But then, as you know, they implemented a mask mandate 2 weeks ago, and you see some data there near the bottom of the slide on West Ada, way to the right, where you don't see the increase, and you start to see some leveling. It's a little too early to know for sure, but again, what's the take home of this slide? First of all, there is an incredibly high positivity rate among the children in the school. The second is masks do work. Unequivocally, they work. The third thing I would say is each school has its own dashboard. Their testing varies in terms of who they're doing, whether it's symptomatic, asymptomatic. Some of the tests are the quick tests, which aren't as accurate, and some are the PCR. Again, that's why you may not see our data as exact as theirs. That's all I wanted to cover, and I'm going to mute, turn my video off, and I'm available for questions.
Thank you, Dr. Peterman, and I apologize for the technical difficulties on the slide. We will be able to send that slide deck to any reporters who would request it. Just let me know and we can send that along, and my apologies for it not being full screen. Dr. Nick Shaligan is a neonatologist at St. Alphonsus and Mednax. So I will turn it over to Dr. Shaligan, who will talk about what he's seeing in the NICU at St. Alphonsus. Doctor.
Thank you. Hopefully you could hear me. If not, let me know. Okay, sounds I see one thumbs up, so I'm going to go with that. I guess I'll just kind of give a little brief synopsis and then leave room for questions. I'd say the biggest thing we're noticing here in the NICU is our census has gone up quite a bit. I mean, whether or not that was going to happen related to COVID or not is unclear, but we definitely have a significant increase in babies who are born to COVID positive mothers. Thus far, none of those recently have actually tested positive for COVID. We did have one baby about a year and a half ago when this all started who did actually test positive but had other complications related to the birth that may have been attributed to that. But as of late, we're seeing an increase of babies who are born prematurely solely due to the mothers, the adults, having complications with their COVID disease, and those babies prior to being born were showing no signs of distress as we would usually expect when we deliver or admit premature babies. I can't speak to too many specifics without breaking HIPAA or giving out too much information regarding specific patients, but I will just say that we're seeing premature babies having certain complications related to prematurity because they had to be delivered for usually respiratory declining status of the mother, and now some of those babies are showing or having complications of just being born early. Others are just sicker than we would expect. Like I said, we do have about 7 babies currently that have been born for those specific reasons due to maternal COVID disease. And there are various gestational ages, and they're all, when you relate them or match them up to equivalent gestational age babies, are definitely appearing to be sicker than we would have expected, even though they've all tested negative thus far for COVID, but they're showing certain complications that we don't usually see in those babies or haven't been seeing, and they're with us longer. And that's the biggest thing we're noticing, and it's obviously adding to our census, adding to the kind of just the overall stressful environment that it is for a parent to have a baby in the NICU, and now the parent has COVID and is separated from the baby in the NICU. And so we're kind of dealing with all sides of that, dealing with the mothers who are often sick and in the ICU themselves, and then they can't be around their babies. And if the dad's tested positive for COVID, they can't come into the NICU. So there's this separation of the family that we're also noticing, and that's having an effect on us, on the staff, obviously on the parents. I would say that's kind of my little synopsis of what we're seeing in the NICU, and I'm happy to answer more specific questions about that. But as an overall, just kind of little summary is we're seeing babies born to COVID positive mothers that are sicker than we would expect them to be, and they're staying in the NICU longer, and that's obviously attributing to a higher census, more staff needed, staff working longer and hours and more days. And yeah, I think I'll leave it at that, just so that there's room for questions, unless somebody wants me to touch on something else more specific.
Thank you, Dr. Shaligan, and I got your title right. You're with Mountain States Neonatology and the St. Alphonsus NICU. I apologize.
Oh, yeah. I mean, I'm okay with that. I don't fully. I mean, yeah. I work here in the NICU. Who is on which part of my scrubs is kind of irrelevant to me, honestly. But yes, that's okay.
Well, thank you. Next, we'll hear from Dr. Jennifer King. She's a pediatric hospitalist director at St. Alphonsus Regional Medical Center. Dr. King.
Hello, can everybody hear me? Okay, great. So we here at St. Alphonsus are just like St. Luke's. We are our top priority is taking care of our infants and children's, and we have many children in our system across our different hospitals in the state, and those children, if they need hospitalization, come to the Boise campus here. The biggest effect that I think our team, our unit has seen has been a ripple effect from the constraints that have been put on the system, the hospital, as it's been flooded with patients, mainly adult patients. And so we've had to, and again, as the NICU census has really picked up, we've had to redistribute our staff. And so we've been dealing with some staffing constraints in the past, but we've found our way through that, and we're able to take care of kids like we always have been and deliver excellent care. It's been challenging. Again, our nurses have been, some of the staffing shortage has come from nurses resigning due to burnout. We've seen that on both the labor and delivery side, the postpartum side, and in the pediatric unit. In addition, every time a nurse gets exposed at work or through, their own personal life, and they call out, that puts a strain on the system too. And we've just had to, like I said, kind of work as a team together to kind of get through this. So we are anticipating this season to have a very busy respiratory season. So it's very concerning that we're seeing an uptick in the COVID admissions, because that's going to put a strain on all the hospital systems in the state. We are seeing diseases or infections early this year. Usually our respiratory season, we see a lot of respiratory syncytial virus, which is RSV. We started seeing that this summer, which was very early, and that wasn't just in Idaho, that was across the country. And we know that RSV and COVID together can prove very deadly for kids, so we're very concerned about that. In addition, as we've seen people just being, tired and tired of hearing about the mask, not wearing the mask, not getting vaccinated, not taking the precautions to prevent COVID, that means they're also not taking precautions to prevent all the other infections that are out there, influenza, rhinovirus, enterovirus. And so we're anticipating seeing a lot of that this winter. It's the other thing we've seen an uptick in is suicide attempts during the pandemic. I'm very concerned about the mental health effects that this pandemic is having on kids. Kids are having to deal with loss and grief at earlier ages, times in their lives when they shouldn't have to, because they're losing family members who were not vaccinated. And worry about all the kids being out sick from school, the missed days of school. I can personally speak to that as a mom. Anytime, my child has any symptom, they go down to the nurse's office, they are sent home. Can't return without a COVID test. And so we've got kids missing a lot of days of school right now. Yeah, it's concerning on many different fronts.
Dr. King, thank you. And we will obviously have time for questions after this. So thank you very much, Dr. King. If you have a question after we get through the other two physicians, I see that Audrey Dutton's already raised her hand. So please raise your hand, or if you have a question you want to put in the chat, put that in the chat as well. We'll now turn it over to Dr. Kenny Bramwell, Assistant Medical Director at St. Luke's Children's, for his perspective and what's going on at the Children's Hospital and at St. Luke's. Dr. Bramwell. You might be on mute, Dr. Bramwell.
Yes, indeed. Thank you. I'll start again. Thank you, Mark, for helping me understand the mute button. And thank you all for being here and for showing the interest that you have both today and historically in these events surrounding COVID. As mentioned already, I'm the System Medical Director for St. Luke's Children's, and I'm an emergency physician or pediatric emergency physician as well. What I will tell you, what we're seeing within the hospital for St. Luke's is, as Dr. Peterman mentioned, there's been an uptick in cases. And we have also seen so far that our admissions to the hospital for pediatric aged patients has gone up about 5 times compared with compared with June and July, where we were having 4 or 5 patients admitted each month. We will certainly hit 20, and we're not even through the month yet. So we are seeing that same level of increase. Something else to bear in mind, over the course of COVID for the last 18 months, children represent about 20% of the population. They have represented about 10% of the positive cases. Recently, that's gone up as high as 25% of the new cases. So children are being infected at a very high rate and being admitted at a moderately high rate as well. It's probably worth mentioning that within the system of St. Luke's, in our 7 hospitals, as of today, we have 5 children admitted with COVID, and we have 300 adults admitted with COVID. So while it is certainly worrisome that the number of children has risen, it is nowhere near the catastrophe that is happening to our adult partners inside the hospitals right now. The hard thing to sort of bear in mind is that that this is just where we are in crisis standards of care and the hospitals being overwhelmed. The pediatric population so far, fortunately, has represented a relatively small number of these admissions. It's certainly worrisome that we're seeing this uptick, but it's not the sort of panic level admissions that we're seeing in adults. Many other parts of the country who are farther down this road than we are have seen that this continues to worsen, and that's our biggest concern, is that these cases will continue to rise, and we will potentially reach a point where there are restraints about the care that we can offer to children. We are not there now. We have an adequate number of beds for the patients that are children who need to be admitted. We have an adequate number of staff to care for them. So I want to reassure everybody that right now, both our pediatric hospital general area, as well as the pediatric intensive care unit, have space to take care of additional children. We certainly don't want more COVID patients, but if they do happen, we are able to care for them. The other thing that I wanted to mention is that September looks like it will certainly be the highest month we have had thus far as COVID patients admitted to the hospital who are children. So this is sort of playing out the scenario that has been seen all across the country, where things are just at a point where it has reached a critical level of numbers of patients who are admitted to the hospital. You know, I want to really emphasize with everybody that the other things that we're doing to try and keep people out of the hospital, we have expanded the hours that we're able to care for patients in our general pediatrics clinics. We have also opened up what we have called a high acuity clinic, which is patients who are too sick for our clinics or too sick for an urgent care. And rather than having those patients who may be dehydrated or having an asthma exacerbation, rather than having them go to the emergency department, we've opened up this additional clinic within the walls of our children's pavilion to try and ease the burden for these families and for the emergency departments, to allow them another place to go to get rehydrated or nebulizer treatments, as examples. I'm happy to answer any additional questions as they come up, and I just really appreciate the solidarity here today. Thank you.
Thank you very much, Dr. Bramwell. Dr. Lauren Miller is Perinatal Health Director at St. Luke's Health System. I don't see that she has a camera with her today, but certainly she can address the concerns. And if I've misread the screening view of your camera, please turn your video on. Otherwise, here is Dr. Lauren Miller. And Dr. Miller, I believe you may be muted. We're not hearing Dr. Miller. Are you with us?
There we go.
Okay,
Okay.
great. Thank you, Dr. Miller.
Well, it says it's on. I thought it was working earlier. Well, we'll see if it wants to start working. But yes, I am the perinatal director for the Boise Central District at St. Luke's, so overseeing the labor and delivery unit, primarily at the Boise campus, and just focusing on everything that we have seen and talked about already today. We're really encouraging our moms to be vaccinated. We have tons of data now on the safety of vaccination for our moms. And we're really trying to focus on vaccinating the whole family to protect the entire unit, both the kids who can't be vaccinated yet, so that the whole house can protect those kiddos and keep them in school, as well as to protect our moms. This second wave of COVID, we have seen far more ICU admissions than we saw during the first wave of the pandemic, and much longer courses for the women in the ICU. We're talking 4 or 5 weeks. And multiple complications stemming from their long ICU stay. So it's not only just the infection with SARS-CoV-2, it is all these secondary infections that occur. It's the complications with their prolonged ventilation leading to complications for them. So it's not just the primary insult, it's all the other factors as well that is making this wave so much harder for our moms. We've certainly seen adverse outcomes, just as we've seen in other states around the country. We are starting to see and feel that here in the greater Idaho area and Eastern Oregon area, where we have had losses of babies, we've had losses of moms, and that is really, truly devastating. And so really, we've just been begging and pleading for our moms and our families to trust us and trust the information that we're giving them, that everything that we have as far as data points to very good safety information for vaccination during pregnancy, as well as postpartum and during lactation. There have been some new data being published recently as we accumulate more cases from around the world that are a little bit scary. We're starting to see an increase in risk of stillbirth that are directly reportable and secondary to no other problem other than COVID infection. I have personally seen several cases here in the last couple of weeks that had no other reason as a cause for their stillbirth other than their proximity to having a significant COVID infection. And that is very scary. We certainly see that with other infections in pregnancy, but not to this extent currently. And I think as time goes on, as we get more data from pathologists and retrospective case series, that we're gonna see more and more cases attributable to COVID infection. And then also on that same note is we have more data now on the vertical transmission. When the COVID first broke, we weren't thinking that the virus was crossing the placenta and infecting the neonates. But just today, new publications were reporting that we're seeing a 1 to 4% rate of vertical transmission. And an article just published in JAMA noted up to a 13% risk of vertical transmission to the neonates. And that is also scary. For our littlest of babies, especially when they're being born prematurely already because of how sick the mom is. So I don't think that I need to reiterate over and over again all the increased risks to moms, ICU admission, invasive ventilation, needing heart-lung machines. We are seeing all of that in our communities, and that is very scary. And these are in moms who don't have any of the other risk factors. We think about, are they overweight? Do they have diabetes? Did they already have heart failure? Did they have other complications? That's not what we're seeing. The moms that I've had in the ICU are completely healthy. They're runners, they're active, they have multiple children at home. They're in their mid-20s or mid-30s. They're not in any other way unhealthy moms, and they are just having the bad luck of catching COVID and having the massive inflammatory response that's landing them in the ICU. And then I can answer additional questions as we move forward. And I'll see if I can get my camera to work.
Thank you, Dr. Miller. So now we will open up to questions. The first hand that was raised is Audrey Dutton. So would you please unmute your mic, introduce yourself and your media outlet and to whom you'd like to address the question, and go ahead, Audrey.
Mark, this is this is David Peter. And before, I'll be very quick. Before Audrey starts, I just wanted to make another point. I really think it's important, and it came from Dr. King and Dr. Bramwell. I think everyone should realize what we're seeing as pediatrician in the outpatient. I've practiced many years. I have never seen so much anxiety, depression, and other mental health issues in children going down to very young ages. Along with this, multiple school problems, not because they're wearing masks, but because of what Dr. King referred to as missing classes. The other thing is again, all the pediatricians in this community are working very hard to keep patients out of the hospital for the very reasons that Dr. Bramwell referenced. And I wanted to just simply say, primary health, we've expanded doing vaccinations out in parking lots. The governor's given us the National Guard. We've expanded hours in our pediatric urgent care. That's all in a response to what our job is, which is to try and keep children out of the hospital and allow them to do what they can do. And I'm sorry to interrupt. And I'll go ahead and mute.
No, that's fine. Very, very good points, Dr. Peterman. Okay, Audrey Dutton, you're first up today.
Hi, thank you everyone for doing this. We all had a lot of questions yesterday at the media briefing, so I'm glad we were able to ask you directly questions. I'm Audrey Dutton from the Idaho Capital Sun, and I was wondering, Dr. Shaligan, or any of the other folks on the call, if you could talk about what the complications you're seeing in babies are that you wouldn't expect to be seeing even in premature babies.
I guess I will start that, and if anybody else wants to add, they can. Without obviously breaking HIPAA, but I guess I can say certain conditions without saying which patients they happen to. I guess the most notable one is we had a baby who was recently maybe born about a month and a half earlier than normal and had a pretty significant I guess we call it a pneumothorax, which is an air leak where somehow air gets outside of the lung, and for one reason or another, and it causes one of the lungs to collapse and maybe cause respiratory failure in that infant. Not something we typically see in that exact age range that this baby was in. And this was significant enough to actually require a very kind of higher end, I guess I should say, hard to say, explain it, but a ventilator that we reserve for babies that are kind of really having significant issues, and also needed a chest tube to help evacuate all the air out. Both of those things not entirely common. In the sense of in the last probably 3, 4, 5 years, we haven't seen that. And whether or not that's directly related to COVID, I can't say 100% because this baby did not test positive for COVID, but the mother was. And so it was one of the several babies born to a mother who was COVID positive and unvaccinated. That's just kind of one example. The rest of them, without giving more specifics, have just had a longer need to be on oxygen in terms of their respiratory course than we would have otherwise expected. And then a couple that have had more, I guess, prematurity related issues solely because they were born premature, meaning we could have probably avoided those things had they made it to term. Again, all of that is hypothesizing that they would have made it to term without the mother getting COVID. But that's, I'd say in a more general statement, we're just seeing more respiratory disease, whether that's an inflammatory kind of picture that is happening, in the lungs of these infants. It's still a little bit unclear, but they're just overall respiratory wise sicker than would be expected. I don't know. Hopefully that answers your question a little bit.
Dr. Miller, welcome. We see your camera is now functioning. So I don't know if you heard Audrey's question or if you have any input or anything you'd like to add to what Dr. Shaligan had to say. You're going to have to unmute your line, Dr. Miller.
Oh, there we go. I think that a lot of the NICU complications that we're seeing are largely secondary to the mom's condition and our necessity to deliver early. We are seeing more preeclampsia in the moms who have COVID-19, and that typically necessitates an early delivery. So I think a lot of that prematurity that we're seeing, and down the road, we might find that there is more of an inflammatory response that's occurring in these kids, leading to some more of the respiratory issues, but that's data that we just don't have yet.
Okay, thank you, Dr. Miller. The next hand up is Melissa Davlin.
Thank you, Mark. This is Melissa Davlin from Idaho Public Television. This question, I think, is for Dr. Miller. Can you give us an idea of either how many stillbirths related or potentially related to COVID-19 or a percentage change that you've seen in the last couple of months?
So we don't have our quarterly data yet. We should have that in the next couple of weeks coming out. So anything that I have right now is mostly just anecdotal data. I can say that just personally, I have reviewed a multitude of cases here in the last month. We're looking at their pathology reports. That's the only thing that I can find. They didn't have lupus. They didn't have any other medical problem. Stillbirths do unfortunately happen. And could it just be the bad luck that they happen to have COVID? Sure. Time will tell, in a year or two down the road when we have a lot more data from around the country in big population studies. I do think that's ultimately what we'll find, is that there is an increase directly attributable, but that's just conjecture at this point.
Dr. Bramwell, did you have something you wanted to add to that?
No, I think Lauren did a good job summarizing what we know right now. We'd like to give you some definitive numbers, and we don't have them yet as far as the increase in stillbirth or in premature birth. It certainly feels like there is an increase that's relatively large in both of those problems. Complications from pregnancy, stillbirth, preeclampsia, and needing to do a delivery sooner than would be ideal because of the COVID infection that the mom has. So it certainly feels like all of those things have trended upward, but I'm afraid we don't have definitive numbers to share with you yet.
Thank you.
Thank you.
And I have another question after other people have had their
We've
first.
got a couple more in front of you, then Melissa will come back. A question in the chat from Corey Evan from the Independent Enterprise in Payette, who has no microphone. So he's asking via chat, and I will read it, and whomever would like to cover this, he'd like to know at what point, what recommendations do you make to government officials about any possible return to restrictions on businesses or gatherings like those which were in place in phases 1 to 3 earlier in the pandemic? And that's addressed to anybody.
I'll go ahead and answer it initially. Again, some numbers to bear in mind based on our hundreds of patients in our hospitals each day right now. What I would emphasize more than anything else is the importance of vaccination. If you look at how vaccination works and you compare people who are vaccinated with people who are not vaccinated, you are 10 times more likely to be hospitalized if you are unvaccinated. 10 times more likely to end up in the hospital if you are unvaccinated. And you are 50 times more likely to end up in an intensive care unit. So the greatest weapon we have right now that we did not have in the first few phases of this pandemic is the vaccine. The vaccine is fantastic, safe, and effective. It is by far our best weapon against all of these problems and against all of these variants. So I would emphasize the importance of vaccination over everything else. When there are times, for example, now where we have a particularly contagious variant, the other things that we can do are also helpful. Masking, distancing, and practicing the other issues that have to do with ventilation and safety. But by far, I would say our best course of action is increasing vaccination in everybody who is old enough to get it.
And if I could briefly piggyback, sorry, Jen, I just saw that.
ahead.
I'll be quick. Is that because that reminded me, we have a pretty small group there's only 3 of us docs here, so we kind of know every single patient that's usually born in this NICU. And especially since COVID started, I can name every single one that's been born to a COVID positive mother. I've happened to be here for almost all of them. And I will say none, so 0 out of probably the 10 or so total we've seen in the last maybe, I don't know, months to a year have yet to be born to mothers who have been vaccinated. Every single baby in the NICU right now who has been born to a COVID positive mother has been born to a COVID positive unvaccinated mother. We just haven't, unless, Dr. King can speak to any babies that would have not ended up in the NICU that maybe were born to a COVID positive vaccinated mother. I have yet to see any. And so I would like to stress the importance of vaccinating versus, rolling back, or obviously masking. All of those things are very important, but I would say the vaccination part, from what we're seeing anecdotally and what I'm seeing in the NICU, is the most important part for mothers to get vaccinated with a safe vaccine that has not proven to show any kind of detrimental effects to the pregnant mother or baby as we currently know. And so I think that is the biggest push that we need at the moment. Sorry, Dr. King.
Oh, no, that's fine. The one thing that I would like to add is, right now we don't have the vaccine approved yet for kids under 12. And so we hope it's coming soon this fall for kids over 5, but that still will leave our kids 0 to 5 vulnerable. And so the best way we have of protecting our children, our vulnerable population, is to vaccinate everyone around them and create, hopefully a cocoon around them. It's not going to be, impervious, but it's our best chance of keeping those kids safe until the vaccine is approved for everyone. It's also our best way, Dr. Peterman can speak to this, to keep our kids in school and cut down on all those missed days, and to end this pandemic so that we can start seeing those levels of anxiety hopefully decreasing, suicide attempts, all those things I spoke to. I'm with everyone here. I can't emphasize it enough that everyone needs to get vaccinated.
Thank you. We will move on. There's quite a list of folks who have to ask questions, so we will try to move this along quickly. Kevin Richert, you're up next.
Thanks, Mark. This is Kevin Richert with Idaho Education News, and I'll ask this to anybody who wants to weigh in on it. I wanted to ask you to juxtapose the reality that you're seeing in the hospitals with these case numbers and with the child case numbers increasing against what we're seeing in school boards. Just last night, Pocatello decided to continue with an optional mask policy. Coeur d'Alene has dropped the idea of revisiting the issue after having a demonstration outside a board meeting last week. Can you juxtapose those two realities, what you're seeing as opposed to what's happening in the at the school board level?
Sure, I'm happy to take a crack at it. I've spent a lot of time in the last year working with a variety of school boards in various capacities, and I will say I'm not coming up with any nice words to describe the way that the school boards have responded to this problem, because they just don't seem to understand the importance of masks in public settings. Masks to me are a rather trivial thing to wear in the course of my day as an emergency doctor, and they've been shown as recently as last Friday in materials from the CDC to change the prevalence of COVID in a school by at least 1/3. In other words, you are 3 times more likely to have outbreaks in schools that don't wear masks. It's actually 3.5, but that's That's a hard number. The challenge is that I think we have, because of inactivity from our president and our governor, we have left the public health decisions up to school boards, which they really have no interest in doing. Some of them have engaged in these discussions and have sort of realized the level of importance that these masks are in preventing the spread of illness, and they've embraced it. Some of them have just chosen, perhaps out of self-preservation from the angry mobs at their meetings, to just ignore the question. And it's unfortunate that the school boards are sort of the only place where this public health issue is being debated, because either national, statewide, or city officials have chosen not to engage. It's an unfortunate burden on the school boards, and to a large degree, it feels like there are two realities. The reality that I experience in the hospital with an overwhelming number of patients, and the reality that I see in the community where few people are masking. So it's not just the school boards, it's many of the members of the public who are simply delusional about how serious this problem is.
Yeah, this is David Peterman. I'm going to tag along with Kenny here on a couple of items. First of all, what we haven't talked about, which is what we're seeing more of in the outpatient, is the impact of coronavirus, particularly long haul in children. I can give you 2 or 3 examples. One is an adolescent who now has a pacemaker, completely healthy. And will he need the pacemaker for the rest of his life? I don't know the answer to that. I have other patients in which were superb athletes in all kinds of sports. And one still is not back to normal. Another one took 4 or 5 months to recover. So the impacts of COVID, as we've talked about mental health, and now we're seeing long haul in children, which is not totally explainable. It has an enormous impact. I also, sometimes together with Kenny, have been working with school boards and county commissioners. I think I've earned the ability to say some of what I've seen from school boards, from my perspective, can only be referred to as shameful. At some point, we need to think beyond ourselves and our community, and in particular our children. And when you think of children getting COVID and spreading it to someone who's immunocompromised or older, that's when you begin to just shake your head. And so I couldn't agree with Kenny more strongly that it is extremely frustrating to see what some of the school boards have done. And at some point, you have to simply say, this isn't right. And along with that, you have to simply say, no, that information is not correct. Vaccines work and are incredibly safe. Masks work and have no negative impacts on children or their learning.
Dr. Miller, did you have something you wanted to add?
I just think one of the other things the school boards haven't been taking into consideration is all the other infections that masks are helping prevent that also help the capacity of our healthcare systems. So reducing RSV, reducing flu going around, the things that do really make kids get sick and potentially die, right? We all hear in the news, oh, COVID's not so bad in kids, right? And I think the school boards are hearing that and not realizing that even if that is the case, some of these kids, like we're talking about right now, do get severely ill, and you don't know who that kid is going to be. So one, we need to protect those kids, but also to reduce all the other burden of illness so that we have enough resources in our hospitals to actually care for the kids who do get RSV and do get flu and do need our help and just have an asthma exacerbation or break their leg out playing on their bike in the street, right? If our hospitals can't care for these kids, then we're doing a disservice to everyone, and masks would help reduce that risk.
Thank you. Rachel Cohn will be next, followed by Jack Schemmel, and then Ian Stevenson, and then time permitting, we'll circle back. And then I see Nicole Blanchard is now logged on and has got her hand raised. We have about 8 minutes left. I'm willing to kind of prolong this if the providers have availability, but let's try and move through these. So Rachel Cohn, and then Jack and Ian, you're kind of on deck and in the hole.
Hi, this is Rachel from Boise State Public Radio. I think this question is for Dr. Bramwell. I was wondering how severe illness from COVID is presenting in children who are sick enough to be hospitalized, and if it's any different compared to for adults.
Yeah, thanks for the question. I will say we're seeing a lot of different levels of illness in our admitted children who have COVID. Sometimes we see what I will call incidental COVID, where the patient unfortunately is suffering from severe anxiety or depression and tries to take their own life. And they, in a series of tests that they undergo, turns out that they're positive for COVID, but they are otherwise asymptomatic. So that's one category of patients that we see, that unfortunately those patients have to stay in the hospital until they're COVID negative because the psychiatric facilities have chosen not to take anyone who has COVID, and that's another discussion. There's another group of patients who have complex medical issues. Perhaps they have trisomy 21, perhaps they have prematurity, perhaps they have other endocrine issues, and they get COVID and their little bodies decompensate because they have sort of less reserve than other children their same age would have. And then we have the children who get admitted with acute COVID, who over the course of a few days become increasingly dependent on extra oxygen and sometimes need to be on a ventilator. That is a small portion of the patients that we are seeing, but it does happen. Interestingly, that sort of acute respiratory COVID is apparently rarer in school-age children than it is in adults, teenagers, or somewhere in the middle. And then the last group of kids that we see have MISC, which is multisystem inflammatory syndrome in children, which is a set of complications that happen about 4 weeks after the patient gets exposed to COVID. And then at the 4-week later point, they have problems with their hydration status, problems with the significant inflammation in their little bodies, and other things that require them to be admitted to the hospital. So those are, in broad strokes, the categories of patients that we're seeing.
Thank you, Dr. Bramwell. Next up is Jack Schemmel from KMVT. Ian, you're on deck, and Nicole, you would be after that, time permitting.
Okay, this question is not necessarily geared towards anyone. Anyone could answer this one. It's kind of been touched on in health and welfare meetings. From your guys' perspective, is it kids getting sick at school and bringing it home, or is it, is it the community spread that's bringing it into schools, or is it the schools bringing it home to parents and stuff like that in terms of COVID-19? Or from what you guys can say on that sense?
Yeah, we have the data to substantiate that. There's no question. In fact, out of 25 our most recent employees who've had a positive test, 23 of them actually have had breakthrough. That is, they've had 2 vaccinations. And in all 23 of these, it's a family member. The majority are their children, a few are spouses. And that's very consistent throughout our statistics.
All right, thank you very much. Up next is Ian, followed by Nicole, and then we'll circle back to Audrey, who's got her hand up, time permitting.
Thanks. This is Ian from the Statesman. So this is sort of a 2-part question. I'm not sure who it's for. I'd heard that there was some discussion at hospitals of putting adult patients in pediatric intensive care wards due to a lack of space. Has that been happening, and or is there a potential for that to happen at your facilities, and how might that affect the care that's available to children? And then I also wondered if someone might be able to speak to the differences between pediatric intensive care beds and adult intensive care beds.
I can start to answer that. So I will tell you, in our children's hospital, as I mentioned earlier, we have 5 patients who have COVID, and in our adult hospital beds, we have 300 patients who have COVID. So in rough numbers, that's 30 to 1 right now. the adult units, both at our St. Luke's facilities and at our friends at St. Al's. The adult units are overrun with what is apparently an unending supply of unvaccinated patients who need to be admitted to the hospitals. So that's the main problem, is that we are running out of real estate. We have shut down outpatient surgeries. We have shut down cardiac catheterization, and we've opened those beds and those units with additional staff, and we've done everything we possibly can. One of the other things that we are looking at doing is using 6 or 7 of our beds that are in our children's hospital for patients who are at a transitional age between what is usually defined as childhood and what is usually defined as adulthood. So what we're looking at doing in essence is using 7 more beds within the children's hospital to take care of 18 to 21-year-old patients. And this is just an accommodation we're making in all of the many things that are happening with crisis standards of care to try and help out where we can. And the reason we can help out currently is those beds are not currently occupied by young children with COVID or other illnesses. So we have the ability to use those beds. Hopefully that answers those questions.
Thank you, Dr. Bramwell. Next up is Nicole Blanchard, and then Audrey, you're up next, but also Pat Caldwell has chimed in, so I may move Pat up ahead just to give him a first crack. But Nicole, go ahead.
Thanks, Mark. This is Nicole Blanchard with the Idaho Statesman. My question is for Dr. Miller. You mentioned that we're seeing stillbirths, losses of babies and of mothers, and I was curious if you could speak a little bit more to the maternal deaths that you've seen, maybe how frequently this is happening, and in these situations, are healthcare providers able to deliver these babies, or are these cases where both the mother and a fetus are lost?
I'm not aware of any cases where we've lost both a mom and a baby, but because of the rarity of these cases and HIPAA, I really can't discuss any details about them, other than to say that they were severely ill with specific COVID complications requiring severe respiratory, significant respiratory support. And that's really all that I can say about those cases right now.
All right, I see that Pat put his hand down, so we will circle back. And Audrey Dutton, you will have the last word, the last question this afternoon.
Thank you. My question is about the unvaccinated teens, primarily those who would be eligible for vaccination. When you're talking with them or their parents, what are they saying about what led them to decide not to be vaccinated? Are the kids and the parents in agreement, or the kids wanted it, the parents said no, parents wanted them to get it, kids said no? What are you hearing from people?
Well, I can speak to that. I think I'm the only one who works in the outpatient. Yeah, I have not encountered something like this before in my practice with vaccinations. And there's 3 or 4 different types. I've had variations of this. I've had teenagers who requested the vaccine and their parents said no. I've had parents who are vaccinated and feel their child should have the right to say no. And then there's another class, which again, if you're in the outpatient, doesn't matter if you're a pediatrician, family doctor, internist, in which the adolescent, along with the parents, are just absolutely no, based on what I would call misinformation. I would also say there's nothing to be gained by confronting an adolescent, and particularly any of those on the call who've had children that are adolescents. That's not going to go well. And with COVID, it isn't going to go well to confront parents. I think what's remarkable to many of us in primary care is these are parents I've taken care of their kids for 15 years, 14 years. I have given them advice which they've taken on influenza vaccine, multiple other childhood vaccines, and sometimes antibiotics and whatnot. And they're very comfortable with that advice. And yet with so much misinformation on this particular vaccine, they're not willing to listen. And so at least my approach, and I think most primary care physicians, is not to confront, is to simply say, what information can I give you that would help you? And I'm here to answer any of your questions. That's been my experience. And while you're on, Audrey, I would be remiss if I didn't mention this. Every reporter that's on this call and children from the age 2 or older need to get their influenza vaccine. So again, I'm speaking from the outpatient. The idea of a twindemic, COVID and influenza, and particularly with children, is very frightening. So I encourage, first, all you reporters, and second, anyone who has children to get their influenza vaccine. And thank you.
Thank you so much, Dr. Peterman. Good advice. Very briefly, we did have one last question in the chat. It's probably more appropriate for Dr. Bramwell, but I will toss it out there. Is it possible to give a characterization of these pediatric hospitalizations compared to adult hospitalizations? Things like length of stay, course of treatment, rough idea of ages. Is there any kind of comparison that you can give to an adult case?
Well, that's a hard one. I don't think I have a succinct way to answer that. As far as numbers of days in the hospital, the one thing I will share is that the children, by and large, have more physiologic reserve and bounce back quicker and stronger than many of us who have gray hair are able to do. So by and large, they don't have the devastating consequences that many of our adults are having. So they're usually in the hospital for a shorter period of time, and they usually bounce back more effectively.
Well, thank you very much. Again, I want to thank Dr. Peterman, Dr. Shaligan, Dr. King, Dr. Bramwell, and Dr. Miller for your time and your expertise. A reminder to all the reporters, we will be posting this on our YouTube channel when the video processes. So if you'd like to get that link, just send me an email and we will make it available to anybody who wants it. And if you would like to get a copy of Dr. Peterman's slide deck, let me know. Again, apologize for the technical difficulties shrinking it down on the screen. With that, thank you all for your participation and your interest, and we will talk to you again soon. Thank you very much.